Good morning, Joan Johnson with you again at J. Johnson Education Center, and we're going to be doing another skill today. It's a very simple skill. You're going to be doing the pulse and the respirations. What's important about that? The client is usually sitting in the wheelchair, and that's how they do it at the state. And so if that person is up sitting, one of the things that I want to do is, of course, when I come in, I'm always going to do it. I'm going to knock, and they're going to ask me to come in. Once I come in, I'm going to introduce myself, and then I'm going to ask them their name. And then before I start that procedure, I'm going to do what? Hand sanitize my hands. You make sure that your hands are completely dry with the skill. And I like to refer to them as cares. We call them skills because you're being tested at the state, but they're cares, okay? And you're doing vitals. And I also want to make sure that the wheelchair is locked, okay? And once her wheelchair is locked, then I'm going to find her pulse. One of the things that you want to do, and what we're looking for, what I'm looking for, the state is looking for, is that one, you take your two fingers and you go along the side of the thumb side of that person's hand. Now, you never ever take a pulse on this side. You never take a pulse with your thumb, but you're gonna find that pulse. And I have a little tidbit for you. There's a bone right there. If you come along that area and you put your hand right under that bone, you can find that person's pulse. And you're gonna actually count that person's pulse to every beat. You're gonna count each beat for 1 full minute, meaning wherever you start on the clock, that's where you will stop. So now, if I wanted to start this process, I would look at whoever is working with me or the observer, and I say, okay, we're gonna start on the 7, and then I would say start. When we get to 7, start. And I would continue that for 1 full minute, and when we got back to the 7, I would say stop. I would then take a form here. Let me show you this form. This form, to record it, I will record the pulse, okay? You don't necessarily have to tell her what it is, but you would just write it down. Then next, I'm going to do respirations. Now, respirations is breathing in and out. It's not like 1, 2, but that's one breath. And you're going to do the same thing that you would do with the pulse. You're going to count each respiration for 1 full minute. You're going to look at the clock. You're going to tell the individual where to start, and you're going to tell them where to stop. One of the things that I do for doing respirations and to help the students is I tell them, look how the person is breathing. Sometimes you can tell them to take their hand and put it on their chest, and you can see her chest moving up and down. Sometimes that's easier for people. Or if they're a tummy breather, I tell them take the hand and put it on the tummy, and you can see. But she's a chest breather, so I would tell her to put her hand here, and as you can see, she's going up and down, and that's how you do her respirations. And so yes, you can tell her that you're taking her vitals at the state, because I want you to remember that this is a testing situation. When you're all done, of course, you're going to give her the call light, and you're going to sanitize your hands, and you're going to write down what the respirations is. Again, you're counting pulse for 1 full minute, and you're counting respirations for 1 full minute. Thank you for joining in, and you have a wonderful day.